Greetings to you, Psychology 201. So, as promised, this is your lecture video for Psychological Disorders, Chapter 15. So, if you read my post that I put inside of the discussion area, I just encourage you guys to get caught up. If you have not gotten caught up and you have papers or posts that's due or past due, I asked you to get those into me by Friday so that I could get them graded, and they'll be out of my hair while I travel. And so this is a video that will go over Chapter 15, and it'll help you with your blog post, and hopefully it'll help you with your paper that's coming up. So, psychological disorders. So just an overview, and I believe you got the wrong glasses here, so we'll see if we can do it without it. All right, so just a psychological overview of this chapter, right? Mental health workers define a psychological disorder as a syndrome. A syndrome is a collection of symptoms. Symptoms may be like nausea, heart pounding fast, shortness of breath is a symptom. These collection of symptoms are marked by a clinically significant disturbance. And so psychological disorders disturb your livelihood. They disturb how you live out your regular day. For example, anxiety may prohibit you from doing the thing that you would normally do because you can't get your breathing right, or you can't stop the negative thoughts that's coming in your mind, or you're tremoring or shaking or sweating profusely. So they hinder you from being productive in your day. So there's a clinically significant disturbance in an individual's cognition, emotion, or behavior. Now remember, we've talked about this throughout our whole class time here, that the cognitive behavioral therapy deals with my cognition. It deals with what I think, it deals with how I feel, and it deals with the behavior that is seen by others. So the DSM-5, which is, DSM is an acronym for Diagnostic and Statistical Manual of Mental Health Disorders. So the DSM-5, which is the latest DSM that's out there, provides an authoritative classification scheme. For example, it separates disorders by names. For example, up under anxiety disorder, just because we used it earlier, would be social anxiety, would be generalized anxiety, specific phobias. Maybe you're afraid of birds or snakes. It would be phobias. It would be OCD would fall up under some anxiety disorders. Misophonia will fall up under some anxiety disorders. Although diagnostic labels may facilitate communication and research, they also bias our perceptions of people, past, present behavior, and unfairly stigmatize these individuals. Yeah, it puts a label on people. And most people don't like to be labeled or don't like to be put in a box. The U.S. National Institute of Mental Health estimates that about 26% of adult Americans suffer from a diagnosable mental health disorder in any given year. National population surveys indicate that the rates of disorders vary across the world. Most who suffer from a disorder show the first symptoms by early adulthood. Yeah. Poverty is clearly a predictor of mental illness, right? It's a predictor of it. It's not a causation. It's just a predictor of certain things may occur. Those who suffer from anxiety disorder may, for no reason, feel uncomfortably tense. Generalized anxiety disorder, something we talked about just a few minutes ago, may experience that suddenly escalates, may experience anxiety, let me read that again, that suddenly escalates in a terrifying panic attack, or may have persistent irrational fear, phobia. Others may be troubled by repetitive thoughts or actions. Obsessive compulsive disorder. In some people, experiencing a traumatic event may result in post-traumatic stress disorder. Most psychologists today believe that anxiety disorders, OCD, or PTSD, post-traumatic stress disorder, may result from cognition, conditioning, or biological factors. Most of us feel depressed sometimes, but depressive disorders and bipolar disorder impair the daily living. You can't get past your thoughts. You can't get past how you feel. Current research on depression is exploring, number one, genetics and biochemical influences. Is it something that you're missing in your body? Cyclic self-defeating beliefs. I like cyclic. Learned helplessness, negative attributions, and aversion experiences. The symptoms of schizophrenia include disorganized thinking, disturbed perceptions, and inappropriate emotions. So researchers have linked certain forms of schizophrenia to brain abnormalities. Studies also point to a genetic predisposition that may work in conjunction with environmental factors. In dissociative disorders, so we've talked about a couple of mental health disorders already. We've mentioned anxiety disorder, we've mentioned schizophrenia, we've mentioned PTSD, we have mentioned obsessive compulsive disorder, and dissociative disorders. Dissociative disorders is that euphoric feeling of being like out of your body, like watching your body perform tasks and your mind is unable to influence. It's a conscious awareness to become separated from previous memories, thoughts, or feelings. Those afflicted with a dissociative disorder may even have two or more distinct personalities. Personality disorders are characterized by inflexible and enduring behavioral patterns that impair social functioning. The most common is a remorseful and fearless antisocial personality. Psychological influences on eating behaviors are evident in those who are motivated to be abnormally thin. All right, so let's do some true and false, fact or falsehood questions. And let's see what you think about these things. So hopefully you've done your reading in chapter 15. This is page 609 in your book, Introduction to Psychological Disorders. How should we define psychological disorders? How should we understand them? How do underlying biological factors contribute to the disorder? How do troubling environments influence our well-being? So we'll run through these things and we'll talk about them, all right? So let's do some fact and falsehood. In some cultures, depression and schizophrenia are non-existent. What do you think? That's false. Number 2, Ritalin and Adderall are stimulants, but help calm hyperactivity in children with ADHD. True or false? Some of you may have had that before in your life. That's true. About 30% of psychologically disordered people are dangerous. That is, they are more likely than other people to commit a crime. This sounds like some stereotyping there. Of course, that's false. About 1 in 4 adult Americans suffer from a diagnosable mental health disorder in any given year. I think we've mentioned that. So number 4, true. By age 50, emotions have become stronger and anxiety disorders become more common. It's false. All right, so let's dive into here. We'll come back with a little bit more true and fact and falsehood a little bit later on. All right, so let's see. Defining psychological disorders. So we talked about the psychological disorder is a syndrome, and a syndrome is an accumulation of symptoms that equate a certain disorder. If you're doing a psychological assessment, you're meeting with maybe someone like myself and you're doing a clinical psychological assessment, then we're going to be looking at symptoms. We're going to be asking you about when was the last time you experienced this, how long did it occur, on a scale of 1 to 10, 10 being the worst ever, 1 being a little bit anxious or nervous, but I'm really okay. Where would you put yourself today in regards to this particular symptom? And we would use what's called self-report. And we talked about self-report before in one of our classes, that this is just a report of the client or the person that you're interviewing. It's their words, their experience, their thoughts on how they're faring or what's going on in their life. And so we'll take their experience, we'll take their thoughts, and we'll gauge them or rate them on a scale. And we will oftentimes, I actually use my DSM-5. I open it up and I read the symptoms that's actually there, and I score how many of these symptoms actually are present in a person's day-by-day journey. I only look at the last 2 weeks just to get a measure of what's been going on more recently in a person's life. And once you do that, the psychological disorder, if there is one there, will just kind of present itself, because the symptoms don't lie. They're there, they're happening. There are some symptoms that people have learned to live with. It just become a part of their daily life, and people go, oh, that's just Jane. That's how she is. And so it could be a part of a psychological dysfunction. All right, so dysfunctional behaviors are called maladaptive. They interfere with day-by-day activity. So that word is maladaptive. Discuss how the medical model and the biopsychosocial influence our understanding of psychological disorders. All right, the medical model, which is what your primary care doctor does, and they look at blood work and neurological things and daily living as well. And the biopsychosocial assessment looks at biology, looks at your environment, where you're living, how you're living, who are your support systems, who are the people that you talk to, work environment, do you get along with people at your job, have you been off work sick quite a bit, are you calling in late quite a bit because of this. It deals with your social friends and outreach outside of work and outside of play and outside of school. Social stuff. Do you have friends outside of these environments that you socialize with? Let's see, biopsychosocial. And so it deals with all of those 3 elements. What's going on with you, what's going on in the work environment, what's going on in a different social setting, for example, maybe a church setting. Some disorders, for example, ADHD, can't be diagnosed unless the symptoms are seen in 3 different settings. And so we will ask clients about, are these symptoms seen at home with your family, with your spouse, or with your siblings? Is it seen at church with your pastor, with your church members, at groups? Do you see it there? And do you see these same symptoms at work? And so that's going to help us to know that these symptoms are sustained and they have not abated, that they are still there, which helps us make a more clear diagnosis. The medical model assumes that psychological disorders are mental illnesses that need to be diagnosed on the basis of their symptoms and cured through therapy, which may include treatment in a psychiatric hospital if it comes to that. Yeah, it's kind of hard to get in a psychiatric hospital. It's got to be pretty bad to get in a psychiatric hospital, but they are here. The medical perspective has gained credibility from recent discoveries that genetically influenced abnormalities in brain structure and biochemistry contribute to many disorders. But psychological factors such as chronic or traumatic stress, they play a vital role in an individual's mental health and wellness. Psychologists who reject the sickness in quotes, idea, typically contend that all behaviors arise from the interaction of nature, genetic and physiological factors, and nurture, past and present experiences. We talked a little bit about nature, nurture. Is it nature or is it nurture? The biopsychosocial approach assumes that disorders are influenced by genetic predispositions, physiological states, inner psychological dynamics, what's going on the inside, and social and cultural circumstances. But not all disorders are culture bound. Depression, schizophrenic, they're worldwide. They're not bound to any specific culture. Classifying disorders and labeling people. Describe how and why clinicians classify psychological disorders and explain why some psychologists criticize the use of diagnostic labels. Okay, in psychiatry and psychology, two different things. In a nutshell, psychiatry may do some of the same types of mental health assessments, but they may give medication in order to minimize symptoms or eradicate symptoms. So they will give out psychotropic drugs. Psychiatrist does. A psychologist will do some of the same testing, but not all will be prescribers. So they may diagnose, treat a mental health disorder, but they may not use it through psychotropic medication. So two different offices here. Psychiatry and psychology classifications aims to predict the disorder's future course, suggest appropriate treatment, and prompts research into its causes. So one may look at the history coming up to date, and another may look at where you are today and let's move on in your future. But to study a disorder, we must first name and describe it. It's hard to fight something that you don't know. And so if you're leaning on, for example, it's like, oh, well, pray for me because I'm not feeling well. So, well, what's wrong with you? Well, just pray and God will give it to you. Well, it's helpful if you tell me, well, I'm hearing voices that are not there. Then I know how to strategically attack the enemy, and so that we can make the devil shut up, right? Versus praying all of these other types of things and you're still not getting any benefit from my prayer because I don't have a specific route to go. So it's helpful to name it. If you name it, you can kill it. DSM-5 is a current authoritative scheme for classifying psychological disorders. This volume is the American Psychiatric Association's DSM-5 5th edition. It was published in spring 2014. The DSM-5, some diagnosis labels have changed. So they did a bunch of changing to the DSM-5 throughout the years, changing labels, moving certain diagnostic disorders to fit in certain groups because the symptoms vary or comply with another type of disorder. They have done real world tests, field trials, and assess clinicians' agreement when using the DSM-5 categories. Some diagnoses have fared well, others have not. Some experts now worry that the DSM-5, even wider, not yet extend the I can't say it, of every day. So it's the pathology of every day. The patterns is what it's trying to say. All right. Critics point out that labels can create preconceptions that bias our perceptions of people's past and present behavior and unfair stigmatize these individuals. So labels put unfair stigmatizations on people's stigmas, on people. So I'm having trouble talking here. Labels can also be self-fulfilling. However, diagnostic labels help not only to describe a psychological disorder, but also to enable mental health professionals to communicate about their cases, to comprehend the underlying causes, and to discern effective treatment programs. All right. Discuss the controversy over the diagnosis of attention deficit hyperactive disorder. So this would be ADHD, attention deficit hyperactivity disorder. From the DSM-5, some of the symptoms you will see with attention deficit hyperactivity disorder is an individual may, especially in kids, they will run, climb on things, they are louder than the other kids, they draw attention to themselves, they may be fidgeters. You may see these kids may be the ones that have the fidget spinners and always got to keep busy, keep doing things. That's the hyperactivity part. If you ask them, it feels like they're being driven by a motor, that there's a motor inside and they have to keep going until they crash. The attention deficit piece may be their lack of attention to detail, their lack of focus, their thought that they're able to multitask many things at one time. But what you may find out is they walk away and abandon all without finishing none. So they may begin several tasks and never complete any. They may lose things like their car keys or their pencils, their notebooks, their backpacks, their shoes. They may lose things. They may be constantly in trouble at school for either not finishing homework, losing homework, only because of this focus piece and having trouble staying on task. That's the hyperactivity part of the DSM-5 diagnosis. Now, with attention deficit hyperactivity disorder, this diagnosis can't be made unless these symptoms are being seen in all three locations. In addition, this diagnosis, they have to have like 5 symptoms of like the 12. They have to have at least 5 of those symptoms in each category to have this diagnosis. And the symptoms have to be sustained, I believe, for 3 to 6 months or more. And so if people deal with this and they're coming to you as an adult, they would more likely attest to having these same symptoms as a kid. They just didn't know what it was, and parents made some allowances for it, or their life became very strict and restricted because of it. All right, so now another key piece of this ADHD is over 75-80% of the Fortune 500 company owners are diagnosed with ADHD. They can spin a bunch of things at one time. The key to this, if you deal with this, the key to this is knowing what you're good at and knowing what to delegate to other people and just oversee the work of other people, but you not directly have a hand into finishing any particular task. They'll do the work. You be the brains behind the work. I know people in my life who are good, they are good visionaries. So if you tell them an idea or say, hey, I want to do this, and what are your thoughts? And they go, you can do this and you can do that, and what about this and what about this, and we can do this and we can both. And they're great visionaries. They can consult with you very well on everything that you need to do. But for them to sit down and put their finger to the many tasks that they're giving out to other people, probably not, because that's not a part of their particular gifting. But they're the visionary to see all of the possibilities of what could be. Part of that is a ADHD mind. It's fascinating. Although the proportion of children treated for the disorder has increased dramatically, go figure, they got all this stuff beeping and bopping at them. Every time they turn their head around, something's beeping at them. The watch is beeping, the cell phone is beeping, the iPad is beeping, the toys in the back seat are beeping, they're watching TV on their way to school. So yeah, so I'm not surprised at all. The pervasiveness of the diagnosis depends in part on a teacher's referral. Yeah. Other counter argue that the more frequent diagnoses of ADHD reflect increased awareness of the disorder, particularly in those areas where the rates are highest. ADHD often coexists with a learning disorder or with defiant and temper-prone behavior. Yes, some kids with ADHD tend to be a little bit loud and more aggressive. Not all, but some are very aggressive. ADHD is heritable, and research teams are sleuthing the culprit gene and abnormal neural pathways It is treatable with medications such as Ritalin and Adderall. And some of the newer things on board is the neurofeedback has been proven to be pretty good with the ADHD mind. Discuss whether psychological disorders predict violent behaviors. The vast majority of violent crimes are committed by people with no diagnosed disorder. People with disorders are more likely to be victims than perpetrators of violence. Better predictors are a history of violence, use of alcohol and drugs, and access to a gun. So I'm going to cycle back to the biopsychosocial assessment, because a part of that biopsychosocial assessment is getting the history. And the history would include, so I ask people, are they a danger to themselves or anyone else, or have they been in the past ever attempted to commit suicide, any of those things. Do they have a history of trauma? Have they witnessed a natural disaster, ever been assaulted, and or they having nightmares, flashbacks, intrusive thoughts as a result of the trauma that occurred in their life. I ask them about their psychotropic drugs, if they're on medications. I ask them if they've ever been hospitalized because of psychotropic related reasons. Have they ever been to the Johnson unit? Have they ever been hospitalized because of a suicidal attempt or medications or something like that? Do they have any criminal activity? Have you ever been to jail? Have you had a history of criminal activity? So all of those things become a part of that biopsychosocial assessment. All right, rates of psychological disorder. All right, this is the last one we're going to do on this video. State how many people have or have had a psychological disorder, and discuss whether poverty is a risk factor. The U.S. National Institute of Mental Health estimates that 1 in 4 adults Americans suffer from a diagnosable mental health disorder in any given year. Remember, that was one of our factor falsehoods. The 3 most common disorders in the United States are depressive disorder, bipolar disorders, phobias, and specific objects or situations, and social anxiety. So major common disorders in the United States. A 21st Century World Health Organization study found that the lowest rate of reported mental disorders was in Shanghai, whereas the highest rate was found in the United States. It's probably getting worse. One predictor of mental health disorders is poverty. Although the stressors and the demoralization of poverty can precipitate disorders, especially depression in women and alcohol use disorder in men, some disorders such as schizophrenia can also lead to poverty. So it's the reverse. So sometimes poverty and the experiences that people encounter when they're in dire straits or when they're in poverty-stricken areas can induce psychological disorders. And on the flip side of it, people who have a genetic mental health disorder, such as like a schizophrenia, this type of disorder may lead to poverty because they cannot manage their finances. They have an inability to hold down a sustainable job. They often lose jobs, especially when they're coming on and off medications. What we see most commonly is people go on medications because they're in crisis, and they'll stay on the medication 3 to 6 weeks. They feel great. As they're recovering, things begin to line up and they're feeling better. Then they get this hair that says, I'm doing so well, I don't need my medications anymore. And so they toss them away or abandon the thought of taking their medications, and within 3-6 weeks later they're back in that same state again. Thus the cycle begins. And so that's my lecture slides on psychological disorders. So I plan to post another slide that deals with anxiety, OCD, PTSD. Before I cycle back, do I want to do the factor falsehood? Let's see, let's do a few more. And you will see the fact or falsehood again, the questions. There is strong evidence for a genetic predisposition to schizophrenia. That's question number 9. There's a strong evidence for genetic. That means it may be in the genes. And so this is true. It may be in the genes. It could be a genetic disorder. Dissociative identity is a type of schizophrenia. And so that would be false. Remember, we talked about dissociative identity is the conscious awareness separated from previous memories. It's like operating outside of yourself, feeling the sense of euphoria, that there's a disconnection with who I truly am. All right, so those are a couple of fact and falsehoods for you. Go forth and do wonderful things. Remember to print your slides out and to do your post on time this week. Wednesday is when the initial post is due. By Sunday, I believe you need 2 answers or replies to other students. And you had a learning team assignment. Let me look before I go on this video here. There was a learning team assignment that you were to do with your team. So since we're doing this video, let's refresh ourselves here. All right, so learning team assignment for the 15th. Do some research on psychological disorders. What are some various kinds of psychological disorders? What are some kinds of mood disorders? Okay, so this video is going to help you with a few of those. And I believe you're submitting this in a PowerPoint with your team. So that is due November the 14th. If you have any questions, feel free to email me. I will be traveling and arrive in Texas on Wednesday, and I'll be there till the 22nd. I have all my gadgets and gizmos with me, so if you need to talk to me or get a hold of me, then feel free to send me an email or text 571-318-9745. You can text that number, it comes right to my phone, and I'll get back with you as soon as I can. God bless you. Have a safe holiday, because I won't see you for the holiday, and have fun. Bye-bye.